Welcome to Suzanne's studio. I'm Suzanne Barnett, your host, and tonight I am so excited to introduce my guest, Dr. Richard A. Blasband, a board-certified psychiatrist who works in Sausalito. And tonight, you, my audience, are going to find out some very, very interesting things. So may I introduce Dr. Blasband. Dick, thank you so much for being here.
Well, you're welcome. Pleasure to be here, Suzanne.
First of all, you are a psychiatrist, but tell what kind of psychiatrist you are.
Well, I practice what is known as psychiatric orgone therapy, which is a discipline developed by the Austrian physician and scientist Wilhelm Reich. Reich was a psychoanalyst and one of Freud's most favored students. But he broke with Freud over the issue of sexuality and the issue of bringing psychoanalytic knowledge to people so that they could be freer. Freud was of the opinion that the culture couldn't be changed, and that people in the long run were really unchangeable. You might be able to help them with some of their complexes or symptoms, but that was about it. Reich, on the other hand, on the basis of his clinical experience and his own investigations as a psychoanalyst and later, felt that people were changeable and that it was a worthwhile thing to attempt to change the society. So he did many things on a social level. This included giving out contraceptives to people in Vienna at a time when, that was kind of verboten. Educating young people about sexuality, and really essentially trying to provide the means whereby people could understand that it was possible to have a different kind of a life, and that the society itself had to change for the subsequent generations to grow up healthy. And Reich had a very clear idea about what he meant by health. You see, his practice differed from the traditional psychoanalytic practice. Traditionally, psychoanalysts sit at the head of the patient lies on a couch, and the method is called free association, where the patient says whatever comes up, and the analyst makes an interpretation from time to time. And the idea was that if there's unconscious material, it comes to the surface, and then the analyst can analyze it. But Reich found that, well, that could be effective in some cases. It wasn't nearly effective enough. And the main reason was because the emotional aspect of what was going on really didn't come to the surface. And Reich could feel that there was like a wall between himself and the patient. And the wall was created by the patient, and it was the kind of thing that he called their character armoring. That is, that particular way in which they behaved. Some men, for example, were always aggressive, and that got in the way of Reich's natural, easy contact with them. The women, when they got to some kind of strong emotional issue, would always run away. And each type did their particular kind of thing. And Reich began to define these different types and describe them as being different character armorings. An armor, is something which protects you. Well, and we create these armorings when we're children in order to survive in a world which is not, does not like our instinctual behavior. The analysts were trying to get the patient to keep those instincts in check. Reich said the instincts were good, and we have to bring them out to the surface. And if they can be expressed, then the person will move into a far more natural state. And that state he called, that was a state of health that he saw in the patients. The problem, of course, was how do you get through the armoring and release that wall so that the patients can express themselves fully? And Reich developed techniques for doing that. And one of the techniques that he did was to constantly show the patient about their character. That, so in the case of a man, for example, that you're always aggressive with me. Anytime I say anything, you always like strike back, or you strike ahead of time. And with a woman, he would say, you're constantly running away from me and from my contact with you. So he would point that out to how they behaved. And they didn't like that. Patients didn't like that, and they would get furious at him. And when they got angry at him, then he had a chance to tell them and show them how irrational their anger was. And they really began to become much more strongly emotional from that point on. So that was one way you got through the armoring. And Reich found another way, which was to work directly on muscular tensions in the body. Because he found that with every kind of attitude that a person had, which was part of the character armoring, there was also a muscular attitude, which they held chronically. For example, he discovered this when he had a patient who was a chronic resistor, in the sense that he was stubborn, stiff-necked stubborn. You know the term. Mm-hmm. You've heard it. And Reich just kept pointing out how stiff-necked and stubborn he was. And then one day, the guy's neck relaxed, literally, in front of Reich. And the fellow was overcome with feelings. And at that point, Reich understood that the character armor is rooted in the body in the form of muscular armoring. And he studied that, and he found that there were 7 different, what would you call it, segments of armor in the body. The eyes, the mouth, the throat, the chest, the abdomen, the pelvis, which includes the legs. And each of these segments would contract, so to speak, tighten up when the person held back a feeling. For example, oftentimes in breastfeeding, the infant is unsatisfied, either because the milk isn't flowing or the mother has developed a lesion on the breast, which is painful when the infant sucks. Well, when those kinds of things take place, the milk stops flowing, or the mother feels agitated and upset. And the infant responds to that. They don't think about things. They're what? A month old, if that. They don't think about things, they just express them. And they express their disappointment and their anger. They want that breast, and they're not getting it. And the mother, in order to deal with this, often will withdraw, or she'll get angry at the infant, one thing or the other. And what the infant has to do then, because it can't tolerate the separation from the mother in either case, the emotional separation, the infant will shut down these desires in the mouth to suck. And they do that by tightening their jaws and tightening their lips. They don't say, I'm going to do this. It's just that something happens automatically. And this is the kind of thing that goes on in certain situations, not just once or twice a day, but many times each day, every time the infant wants to suck. And it can go on, for months and months and months. Well, when this kind of thing happens over time, you end up with a tight jaw. Or someone who's saying, a child wants to say no all the time because they're being frustrated, and they develop a stiff neck and stubborn attitudes. These things become the deep physiological structure of the individual. Well, Reich found that if you work directly with your hands and your thumbs on these armored segments, say the mouth, and release the tension, that all these blocked emotions would flood to the surface. And when that kind of thing happened, he would release the segments in the armoring sequentially from the head down towards the legs. And he began to notice that as each segment of armoring was released and the emotion was expressed, that the person's whole body would go into like a ripple, an undulation, like a sine wave, they call it. And the person would say, I feel like electricity is moving through my body. And every time they would breathe and take a deep breath out, a sigh, like, ah, a relaxing, pleasurable sigh, which Reich asked them to do, this undulation would start in again. And it would end at the tip, at the base of the pelvis, and the pelvis would move forward and up. And Reich called that the pelvic reflex, or orgasm reflex. And it's something that isn't often seen because most people are too armored, even in sex. And so because it isn't seen, it isn't even recognized. And so much of the research which is done in psychosomatic medicine, for example, is not valid because they don't recognize the armoring and this whole reflexive piece of behavior. So with these two kinds of things, the character armor, the work on the character armor, character analysis, Wright called it, and the work on the muscular armoring, there's a whole new kind of therapy developed. And finally became, when Reich discovered the energy involved in the body, which he identified as what he called orgone energy, for reasons which I'll give later, he had developed what he called psychiatric orgone therapy. And it involves, at the deepest level, the movement of energy through the body. And you've heard today of all these energy therapies. They all come from this, essentially.
From Reich.
Yes.
Let me ask you, Dick, how you've been practicing this for 50 years.
Yes.
How has it worked with your patients?
Well, I would say I'm very pleased. Although everybody doesn't get fully released, that's very difficult to do. Mm-hmm. Most, I would say 80% of the cases, that they release sufficiently so that their lives change dramatically.
In what way?
Well, first place, they lose their symptoms, whatever their symptoms may be. Whether,
really?
Yes, whether it's depression or maybe it's a loss of contact, a paralysis or anesthesia that you used to see the old days in hysteria, and overeating, that kind of thing, sexual difficulties, difficulties getting erection, sustaining erection, in women, loss of feeling. But in all cases, these things improve dramatically. And a person becomes much more capable of feeling, and not only feeling within himself, but sensing the environment. And so they become much more sensitive. And when these kinds of things take place, they are far more, what would you call it, receptive to what is going on, and can make much more rational decisions about their life because they have more information.
Compared to psychoanalysis, which isn't hardly used anymore, right?
No, not so.
Is it really? It's still?
Yeah, there are plenty of psychoanalysts still around. Yeah.
Really? Well, but compared to that, in terms of the duration of treatment, would you say that the Reichian is quick, faster? Because psychoanalysis could go on for, years.
Well, in Reichian therapy, it depends on what you want. If it's a matter of symptom relief, it's very fast. For example, bringing someone out of a depression.
Really?
Without drugs, yes.
Without drugs?
Without drugs, yeah. But drugs get in the way. The reason they work is because they dampen down their energy flow. And we're trying to get the energy moving. Mm-hmm. So we try and get people off drugs as quickly as we can. I don't know of any really decent studies which would compare the two modes of treatment. I learned how to do a psychoanalytically oriented psychotherapy when I was at Yale, and I learned how to do that very well. And I use that quite a bit when I do therapy. My general impression is that the psychiatric orgone therapy is more effective, and that's why I use it. Also, it suits me. then that's very important. Because I think that the real, when you come to rock bottom, the thing that counts is the therapist, who he is, and what kind of resonance he establishes with the patient. Now for me, using psychiatric orgone therapy, I can best express who I am to the patient, and that resonance, which is so necessary for cure, is established.
How do you do that, though, with the patient? How do you establish that resonance?
Well, in several ways. One is simply by being myself and dealing with the wall that patient puts up between themselves and myself. And once you deal with that character armoring and that wall, then they can reach out to you and they can accept what you have to offer.
Is that called transference? Well, I know it is in psychoanalysis.
It's different. Transference is where the patient begins to see the therapist as somebody from their past. Okay? So they develop, in most cases, or in many cases, a warm feeling if they had a warm caretaker when they were younger. This is different. Transference is not real contact. I mean, if I began to see you, say, as my mother, and relate to you in that way.
I'm old, honey, but I'm not that old. Yeah, go on.
No, but if you were my therapist, for
Yeah.
example, that
Yeah.
would happen spontaneously. But that's not real contact.
Yeah.
You know?
Right.
Right.
Yes. Yeah.
And to an orgone therapist, it stands in the way of contact, and one deals with that for what it is. That is that it interferes with true contact. I sit beside the patient, and the patients are usually in their underwear.
No kidding.
No kidding. That's so I can see what their bodies are doing, because I'm going to work on their bodies.
Oh, you actually work on their bodies?
Yes.
Wow.
You know, I will massage the jaw and the shoulders, you know, and press on the chest. Most people, if this is their full capacity for breathing in and out,
Yeah.
most people are like this. They
Because
just,
they're holding, yeah.
They're
yeah,
holding,
yeah.
yeah.
Sure.
and they begin to learn that in childhood. They start to hold their breath, which is something that we do when we're frightened, you know, at the loss of somebody, or that somebody's going to hurt us, and we get scared. We hold our breath. Well, this goes on dozens of times every day in a typical household. So that by the time the person is an adult, they're in a state of chronic inspiration. And it's very difficult for them to breathe deeply, especially in emotional situations. And that prevents the intake of energy and prevents energy from moving through their body. So I work on their chest, you know, work on the muscles in between the ribs, which hold the ribs tight. And I'll press on the diaphragm, and I'll push on the chest to get the person breathing again. And just doing that with someone, even in their first or second session, the person might just break down and begin to cry and sob deeply. Not because I've hurt them in any kind of way, but because they're letting the energy move through them again. Yeah.
Do you think that, this is such a stupid question really, but do you think that you're a medical doctor with tons of training, do you think that other medical doctors, not just psychiatrists, can really believe in what this or
Only if they try it. If they try it, they may find, you know, that it really works. And it's very effective in so many cases of psychosomatic illnesses, things like that.
Yeah. This is so fascinating. I had no idea. I mean, I was reading your webpage, which is like 26 pages, you know, next. You have really such wonderful training, Dick. You really do. And to think that you've been doing this for 50 years and it works. Did you have it done to you?
Oh, of course.
Of course, you would have to, right?
Yeah, my therapist was Ellsworth Baker, who was trained by Reich and was considered generally to be Reich's best student. And it was Dr. Baker who, with myself and several others of his students, created the American College of Orgonomy, which was designed to be an organization that would be authoritative in the sense of being able to, where people could come and learn the facts about the science. Yes.
It sounds so good. I mean, it really does. But sometimes it's hard for probably most people to believe.
Or
right?
to accept. It isn't for everybody.
No, that's it. I can imagine.
What one has to do as a patient in this is tolerate all this new energy movement. And generally, oftentimes people will feel frightened when that first begins.
Of course. But it's again saying that I always have thought that there's no way that anybody is going to change me. You know, not that I don't want to be changed, but I have such, ideas that it's impossible. And so, would I be a good patient, do you think, with that kind of belief?
Probably not. Most of the people who come to me are people who know how I work.
I see.
And they're familiar with Reich's work.
I see.
But I've seen patients change in their political views.
No way.
And not because I told them to be like move left or move right. What happens is that no matter what your position, if you're a staunch Republican or a leftist, and those are both artificial positions. They're the result of armoring.
Really?
Oh, yes. I would say 98% of the people who go to the polls are voting not because of a rational understanding of what the issues are and whether that person who's up for president, say, can bring those issues to fruition, can solve the problems. They're not doing it for that reason. They're doing it because it's like a knee-jerk reaction. That my daddy was a Republican, and I'm a Republican too, and my kids are going to be Republicans. That kind of thing.
It's that old belief system.
Right.
You know, we only have a few minutes left, and you're coming back next month because we have the other type of therapy that you do. Could you just tell us a little bit about that before we close?
Well, it's a method of healing, which is based on the findings of Nikolai Levashov, who was a master healer. Certainly, I've met some great healers, and he was way above them all, as well as being a theoretical physicist. So not only did Nikolai have the capacity to heal and to train others how to heal, but he's the first person I ever knew who understood what he was doing as a healer and who wrote it down and could convey it to others so they could use it. Most people who do healing, and I've done a lot of reading in the literature, 35 years of books and articles, and very rarely do you come across anybody who says that they really know what they're doing. Most of the times they say, well, I put my hands on them, and they feel energy moving through them, and then they feel better. Well, a lot of questions in all of that. It's not sufficient for me as a scientist, as an acceptable explanation. But with Nikolai, I was very fortunate in finding somebody who really understood what's going on and was able to convey it. And I do that with people.
So we have to do another show next month, right?
Okay.
Talking about Nikolai, who's been on my show over the years 3 times. In fact, you were on my show too 4 years ago with other people.
Well, I'd be glad to do that.
Well, you have to, absolutely.
Okay.
I mean, it's so fascinating to have a person like you, Dick, on the show, for the viewers to see that there are other things going on and that there are other things that work, maybe not for everybody.
Well, I'm happy to talk about it.
Yes. So we have a couple of minutes, and we need to leave the audience dying to know a little bit more about you. Could you say just a couple of more things?
Well, I was trained in medicine at the University of Pennsylvania and in psychiatry at Yale University, where I taught and helped train young physicians who wanted to become psychiatrists. And I've lived out here in California for about 25 years now. Always loved California. I did my internship in San Francisco, but it took me 30 years to come back because I helped work with Dr. Baker in setting up the college, Bergen College of Orgonomy, and I edited the Journal of Orgonomy. After Reich died, we filled in the gap, so to speak.
We have run out of time. I have just been really so thrilled, really thrilled to have you as my guest.
Well, thanks, Suzanne.
And I thank you so much, and we'll see you next month.
Wonderful.
Thank you again. I want to thank our beloved crew. We have, I never say cool, but this crew is hot. I mean, you met them. And, we're all volunteers and we're all hams. We love it. It's just an extremely exciting thing to do. KMVT, our station, is really fantastic. And I'm just so grateful that I'm here. And of course, I want to thank our audience for watching. And I can't wait to see you next time. Bye-bye. Bye-bye.